Welcome to the CT Educator Podcast. I am your host, Karina Hogan. I am a registered CT technologist with 20 years of experience and knowledge. I help new CT technologists level up their CT training so that you can become a successful technologist. I'm also a mom and committed to sharing my knowledge and expertise to help you build your confidence, know the CT basics so that you can deliver quality patient care. So let's get into it. Hello. Welcome back, everyone. Welcome back to the podcast. Hope you guys are having an amazing week. Is it getting warmer out there or what? So, yeah, like my kids are getting ready to go on spring break. So, this should be fun. Trying to see what kind of activities I can get them into, get them out of the house because, cabin fever is a real thing. And, with the winters and snow, it's terrible, especially if you live in the Midwest. Okay. So, a little housekeeping before I go ahead and start today's episode because there are some good topics we're going to talk about today. And I'm going to share some, knowledgeable tips for you. Okay. So, I am hosting a live event, I believe next week or the week after. So, make sure you check out the show notes to sign up for the live event. It's a 2-day live event. I am going to be hosting it on TikTok Live. So make sure you fill out the form to sign up for the live event. I am going to be talking about patient centering and how to master it. So this is a very important topic. And I know I drill this shit into your brain on almost every podcast episode, every TikTok video, every Instagram reel. So we're going to learn this shit right. Okay. So sign up for the live event. It's going to be in the evening, so make sure you guys sign up for that live event. I believe it's around 5 p.m. CST time. Get in the live event, get your butt in there. We're going to talk about all patient centering, and then I'm going to do some Q&A after the live event on the second day. So get your asses in there and sign up for the live event, okay? Also, make sure you guys follow me on TikTok. I post a lot of really good content on there. I know I've been a little bit absent because of illnesses, and things like that with my kids and work. So I'm kind of shifting my work schedule a little bit so that I can bring you guys some more educational stuff. Also, if you haven't subscribed yet, subscribe to the YouTube channel. I post a lot of good stuff on there, longer form videos. You can catch all the videos of this podcast on the YouTube channel. Plus, I have an excellent masterclass that I taught a while back that you can get in on all the action. So make sure you subscribe to the YouTube channel. It's really, really good stuff. Okay. Plus, I will be hosting some YouTube lives. It'll be Q&A sessions, and I'm going to be doing something called Tech Tip Fridays. So I answer all your questions, your DMs, things like that on that live stream. Okay. So make sure you guys get in on that. Okay. Another thing, and I know I've talked about this on my previous episodes, if you are a CT technologist, we always have to keep our bodies into shape. Okay. We move a lot of patients. We do a lot of physical demanding activities when it comes to our job. So the most important thing is to make sure that you're physically fit. So if you are interested in 12 weeks of online fitness coaching, my boyfriend, who is an amazing person, he will get you summer ready because summer's right around the corner, guys. Okay. He will give you dietary advice. He will give you a structured plan on your workouts. He will coach you through the whole thing for the whole 12 weeks. He will set you up with an entirely personalized, customized program. So if you're interested in that, there is a form in the show notes that you can fill out, and it will link all of his socials and everything to it so you can check out all of his work. Okay. So if you need coaching, get summer ready, get your asses in the gym, get that mind drama to a minimum, and fuck all those negative thoughts. Go check him out. He is awesome, and he will get you on the right path. So everything will be in the show notes. Okay. Now let's get into today's episode. So today's episode is we're going to be talking about why some CT technologists excel while others tend to struggle. Okay. This is an important topic. And I know when I was doing the notes for this topic, I was like, this is something good. It's something that we should talk about because you are going to see as you go through your training, as you gain more experience, you go to different places, different, facilities, hospital, clinics, whatever the case is, even around the country. Okay. How some technologists tend to pick up, how to navigate and work around CT and just, operate as a technologist on their own faster, while others tend to struggle and need more time. Okay. Because everybody's different. Everybody's learning curve and their learning capacity is a lot different. Some people need more time, some tend to pick it up a lot faster. So, I'm going to give you a few points and then I'm going to share a story on a technologist that I worked with that struggled and I got her to the path of success with the right guidance. And she passed the registry too on the first time. So, I feel that when it comes to, people who excel and some that struggle, where you have to look at is making sure that you focus your importance on hands-on training and learning. Okay. It's not about just passing the registry. And I think that's where a lot of technologists struggle because they seem to think that, oh, I have to do this so I can pass the registry and then I'll be, better and competent. Not fucking true. Okay. And I know I said that in the last podcast episode. The importance of hands-on learning is to make sure that you operate correctly. You make sure that you center your patients correctly. You execute those exams correctly. You set up, your room and checking labs and making sure that you have correct IVs, correct orders, making sure that you're hands on your learning and you know exactly, okay, if I'm going to do this, this is the protocol I need. These are the reformats I need. And to make sure that you have a perspective and good knowledge on that hands-on learning. And then it doesn't stop there because you have to make sure you continue that education as well, because there's a lot of new things that get incorporated because technology is always changing. Okay. It's not about just passing the registry. Yes, a lot of hospitals need you to be registered. So the registry and those credentials are very, very important. However, you're still going to you could still have that registry under your belt and still be struggling on how to center a patient correctly, how to give contrast the proper way, the amount of contrast, your IV skills, the workflow in the department. Like you could still struggle with these things. And that's why I tailor my coaching program to make sure that you learn the basics. And I have an awesome checklist that you can download in the show notes on what you need to learn in the 8 weeks of training as a new technologist. Okay. So another piece to this is confidence doesn't come from knowledge. Confidence comes from repetition, consistency, and lots of practice. Okay. Your confidence, it's not about how much you know, because I'll tell you, there's some cocky ass, egotistical technologists that I've worked with in the past. And when it came to their consistency in exams and the way they execute it, it looked like shit. Okay. Just because you may know a lot doesn't mean you really know a lot. Okay. So it comes from practicing over and over. It comes from lots of repetition, like doing that exam over and over and over again until you perfect it, okay? Or at least until you get it right. And consistency. Consistency on you set it up correctly the same way. You do this the same way. You do that the same way. Because we all know them heads without contrast and them abdomen pelvises with IV contrast, they're fucking boring as shit, okay? And a lot of times when we get like a full body trauma and we're doing this and that, it gets exciting, you know? Yeah, we're pumping out a bunch of exams, but it gets exciting, right? So confidence, when you want to be confident and you want to feel confident, it comes from making sure you practice over and over, consistency and repetition of those exams. I don't give a fuck how knowledgeable you are. Knowledge is important too, okay? But when you don't have those other three principles, your knowledge doesn't mean a thing, okay? You have to at least practice repeat, and be consistent with what you're doing. That's in anything in life. Whether you're accomplishing a goal, you have to practice, you have to have consistency, and you have to do it over and over and over again to reach that goal. Okay? Now, a lot of the questions that I get asked is why hospitals barely provide structured training. I could tell you what it is. The reason that they do is because a lot of times money is a factor, okay? For them to build a hospital-based training program, it costs money. And you have to have resources and people who are skilled enough to run such program, okay? That's what I think it is. And I know there were hospital-based programs, years ago, and they have done away with a lot of them because they just rely on the department and say, okay, well, you have a lead tech, you have a manager, just, all the incoming people, just show them what they need to do. That's not very successful because your success rate is not going to be very high. And I can tell you, you're not going to have techs that are going to be competent that way, especially if you have, a lead tech who really isn't competent and then teaching that new oncoming technologist. That's a recipe for disaster. I can't tell you how many times over the years I've seen that. So the thing is the structured training, it takes time, it takes resources, and it takes money. And you have to have somebody who is skilled, who has the not only the knowledge, but has, the consistency to keep that program running. And that is somebody who knows their shit. Because you need a technologist that knows their shit so you can have successful people in the department and be the go-tos in those departments. Okay. That's why I stress the importance of coaching and mentorship, because in order to have those go-tos, you need that. And that's why I structured my program to do that specifically. Now, I'm going to share with you a personal story before we wrap up this episode. There was a technologist that I used to work with. Okay. And this is an interesting story because this technologist and I really didn't get along in the beginning. So this was one of the hospitals I worked at. It was one of the very first trauma hospitals, because the trauma hospital I work at now, it's like the second trauma hospital I've worked at in the state that I live in. So the very first one, and I can say that this technologist was very cocky, thought she knew everything, thought all kinds of things, okay? And really struggled with protocols and would not hear anybody's, constructive criticism on how to correct her mistakes. So another technologist and I were having a conversation, and he was asking me as far as anatomy and how he would point out, because he's trying to make sure that his carotid CTAs were on point. So I was doing that. And so she intervened and she says, you're not an instructor. You don't need to be telling anybody that. And I said, well, this is good collaboration, because my, knowledge and experience, I can share it with somebody, because if they don't have a lot of experience and they're asking me because they know they've seen my work and they see that, yes, I do good work and I, pump out optimal exams, they're asking me how they can perfect their exams. And she says, well, you need to just shut up. Okay. So, and I didn't take offense to it. I said, okay. So there was this case where it was on a pediatric patient, and the pediatric radiologists are very specific as far as you do not start the scan until I arrive. Okay. So I went ahead, and so I said, okay. And I said, well, do you need help? And no. Okay. So pediatric radiologist comes and he says, this is not the protocol that I asked you to do. He goes, do you even know what you're doing? So she turned to me and said, hey, do you mind helping me? And I said, absolutely. Because it doesn't matter how cocky or egotistical you're going to be, I'm still going to help you out. Okay. And this is not a gotcha, told you so moment. this is a moment where the technologist can reflect and say, okay, maybe I was a fucking shithead and maybe I don't know everything. Okay. So the thing is that I went ahead and I said, okay, I asked the radiologist, I said, okay, from where to where do you want to accomplish this? Are these technical factors as far as KV and MES okay? How much contrast do you want to give? And this and that. So I basically instructed her, I said, okay, he wants from here to here. This is how much contrast you're going to give. This is the flow rate you're going to do. This is the protocol you're going to use. And you're going to get an optimal exam. So lo and behold, radiologist is watching as we're doing this, and we get exactly what he was asking for, the right amount of contrast, and he was able to diagnose the patient right then and there because they were looking for something specific. And then that patient got the treatment like right away. Okay. So sometimes when techs are struggling, and it may be an ego thing. It may be, oh, well, I know what I'm doing because I've been a tech for 8 years. And this technologist had been a tech for 8 years. I was a tech a lot longer. But you can't let your ego and your pride just take over, because when you get in a situation like that where the patient's life is on the line and they need that treatment like now, and that CT is going to determine the type of treatment that they're going to get, you have to let others help you. Okay. So sometimes we have to drop our ego. We have to drop our pride and stop being fucking shitheads sometimes, because other techs can help you. I can tell you, there have been younger techs that say, hey, well, I did it this way, this way, this way. And I'm like, I think I'm going to try that. Because some younger techs, the way they're trained when they come from other places, you can learn something from everybody. So the right type of guidance is learning something from everyone. And I always encourage that because we don't gatekeep. Okay. So that is it for this week's episode. I hope this episode was insightful, gave you good information. I try to keep these short and bite-sized so that you can get some key points and takeaways in this episode. So make sure you guys check out all the show notes on everything I talked about in the beginning of the episode. So if you want to join my coaching program, there's a link to join. Make sure you subscribe to the YouTube channel. Follow me on all socials. And if you need online fitness coaching, make sure to check out the show notes and click the link, fill out the form. Okay. So thank you so much for joining me in this episode, and I will chat with you guys in the next episode. Thank you for listening to this episode. If you would like to share your CT experience, have an interesting story to share, or need help in your CT training, please email me your questions at contact@thecteducator.com. Follow along on Instagram at the CT Educator, also on Facebook at the CT Educator. Don't forget to like, share, leave a 5-star review, as this will help support the show and it'll reach all of you that need guidance. Thank you for listening, and happy scanning.